Multiple choice question number 1.
A male patient, 33 years old, presents with symptoms of fever and difficulty breathing. Pleuritic chest discomfort, rigors, and sputum reduction are not present. Diffuse perihilar infiltrates are revealed on the chest X-ray. While taking levofloxacin, the patient's condition becomes worse. Bronchial washing stained with methenamine silver reveals structures resembling cysts. Which option is the most accurate? A. Definitive diagnosis can be made by serology. B. The organism will grow after 48 hours. C. History will likely provide important clues to the diagnosis. D. Cavitary disease is likely to develop. E. The infection is unlikely to recur.
C is the answer. In immunocompromised patients, Pneumocystis jirovecii pneumonia, PJP, can manifest with dyspnea, dry cough, fever, and diffuse bilateral infiltrates, seen on chest X-ray. Clinical suspicion and risk factors are the foundation of a diagnosis, which is then confirmed by identifying the organism in samples such as induced sputum or bronchoalveolar lavage, often with the use of silver stain to see cysts. Cysts may cavitate, but this is rare, and laboratory results such as increased serum beta-D-glucan can support the diagnosis. However, culture is problematic owing to poor growth. In immunocompromised patients who are not receiving preventative treatment, recurrence is more likely to occur.
Multiple choice question number 2.
While preparing food, a 42-year-old lady accidentally cuts her finger. 2 days later, she was suddenly sick with a high temperature, shaking, and chills. Her hand starts to swell and bleed slightly. Her situation worsens later that night as the erythema spreads and her hand turns a dark red color. Over the affected hand, bullae form and a diminished feeling of touch develops. What is most crucial for this patient's care? A. Surgical consultation and exploration of the wound. B. Treatment with clindamycin for mixed aerobic-anaerobic infection. C. Treatment with penicillin for clostridial infection. D. Vancomycin to cover community-acquired methicillin-resistant Staphylococcus aureus. E. Evaluation for acute osteomyelitis.
The correct answer is A. The quick start and rapid advancement into cellulitis, with dusky, dark red skin pigmentation, bullae, meaning blisters, and loss of sensation, anesthesia, make this infection remarkable. The patient usually has fever, tachycardia, and other symptoms of SIRS. The clinical findings suggest necrotizing fasciitis, a fast-growing, deep soft tissue infection. A penetrating injury or trauma allows Streptococcus pyogenes to infiltrate the deep fascial layers. Emergency surgery to explore the fascia and muscle layers can save lives, since Streptococci, Staphylococci, mixed anaerobes, and Clostridial species may infect necrotic tissue. Gram-stained and cultured samples should be taken. Broad-spectrum antibiotics for these bacteria are important, but immediate surgical debridement is the major treatment. When antibiotics fail to treat a cellulitic infection, acute osteomyelitis may be suspected.
Multiple choice question number 3.
A 65-year-old man presents with progressive exertional dyspnea, bilateral lower limb swelling, and a history of hypertension and ischemic heart disease. Examination shows bibasal crackles, elevated jugular venous pressure, and a displaced apex beat. Echocardiography reveals a reduced left ventricular ejection fraction. Which of the following is the most appropriate initial pharmacologic treatment to improve mortality? A. Loop diuretics. B. Beta blockers. C. Calcium channel blockers. D. Digoxin. E. ACE inhibitors.
E is correct. In heart failure with reduced ejection fraction, ACE inhibitors are the best initial treatment as they lower mortality by reducing cardiac workload through renin-angiotensin-aldosterone system inhibition. Beta blockers also improve survival by decreasing heart rate and myocardial oxygen demand, but are typically started after stabilization. Loop diuretics relieve symptoms like edema and breathlessness by reducing fluid overload, but do not improve survival. Digoxin provides symptomatic relief and reduces hospitalization, but lacks mortality benefit. Calcium channel blockers are generally not recommended in systolic heart failure, as they can worsen the condition. Thus, ACE inhibitors and beta blockers are central to improving outcomes, while diuretics manage symptoms.
Multiple choice question number 4.
A 55-year-old man presents with sudden onset, severe chest pain radiating to his back. Blood pressure is 180/100 millimeters of mercury, and pulse is 110 BPM. Physical examination reveals a new diastolic murmur and unequal blood pressures in the arms. What is the most appropriate initial diagnostic test? A. Electrocardiogram. B. Chest X-ray. C. Transthoracic echocardiography. D. Computed tomography angiography, CTA, of the chest. E. Magnetic resonance imaging, MRI, of the chest.
D is correct. Electrocardiogram, ECG, is important in chest pain evaluation but cannot reliably diagnose aortic dissection. Chest X-ray may show a widened mediastinum but lacks specificity for dissection. Transthoracic echocardiography, TTE, can identify complications such as aortic regurgitation and pericardial effusion, but may miss distal dissection segments. Computed tomography angiography, CTA, is considered the gold standard for rapid and accurate diagnosis of aortic dissection, clearly displaying the intimal flap and extent of the dissection. Magnetic resonance imaging, or MRI, is highly accurate but less commonly used in acute settings due to limited availability and longer scan times, making it less ideal in emergencies. Therefore, CTA is the preferred initial diagnostic test for suspected acute aortic dissection due to its speed, diagnostic accuracy, and accessibility, ensuring prompt diagnosis and management.
Multiple choice question number 5.
A 60-year-old woman presents with chest pain on exertion. To assess for coronary artery disease, which of the following diagnostic tests provides the most accurate anatomic detail and prognostic information? A. Electrocardiogram, ECG. B. Chest X-ray. C. Coronary computed tomography angiography, CCTA. D. PET myocardial perfusion imaging, PET-MPI. Or E. Stress echocardiography.
Correct option is C. Coronary computed tomography angiography, CCTA, is preferred initially for anatomical assessment of suspected coronary artery disease due to its accuracy and ability to guide management, often supplemented by functional testing when necessary. CCTA provides excellent anatomic detail of coronary arteries, assessing stenosis and plaque, with significant prognostic value in stable chest pain. Electrocardiogram, ECG, is useful for detecting arrhythmias and acute ischemia, but does not provide anatomic visualization of coronary arteries. Chest X-ray can show the heart and lungs, but cannot evaluate coronary anatomy. Positron emission tomography myocardial perfusion imaging, PET-MPI, offers functional assessment with high sensitivity and specificity, including microvascular evaluation. Stress echocardiography detects ischemia through wall motion abnormalities, but has less anatomical resolution compared to CCTA.